My name is Jarrad Merriman, and I'm an orthopedic surgeon here at SCOI. I'm a sports medicine trained surgeon, but I also have an interest in anterior hip replacement. So I think it's important to know that you can have a great outcome with your hip replacement regardless of the approach. The two most popular approaches are the anterior and posterior approach. And essentially that just refers to where your incision is going. So in an anterior approach, you get an incision in the front of your hip. Posterior approach, you get an incision in the back of your hip. So I initially noted that the anterior approach was different when I was a resident actually. And it always seemed that the anterior approach patients were a little bit more comfortable. They were ready to go home. They were sitting in their chair, ready to be discharged. And so I kind of gleaned the differences between the approach then. When you have a hip replacement from the back, you have to split the gluteus maximus muscle, so which is one of the big buttock muscles. In the front, the muscles aren't cut, rather they are pushed aside to get to the diseased hip. So this is a muscle sparing approach, and then the diseased hip can be removed and the implants can be placed. So some of the other benefits of having an anterior hip replacement are the positioning of surgery. So in an anterior approach surgery, you're on your back. And because you're on your back, we can utilize an x-ray machine. And so that x-ray machine gives us live feedback. How your implants look, are they appropriately sized? We can also get data on your leg lengths. So utilizing x-ray because of your positioning gives us a lot of real-time feedback as we put in your hip replacement. So in terms of the early post-operative recovery, there is a lot of data that tells us that people have less pain. And it's probably related to the fact that we're not splitting the muscle. It doesn't mean you're not going to have any pain. It just means that usually there's a little bit less post-operative pain in the first several weeks. Hopefully so that you don't need narcotics or very little narcotics. So my goal for early activity after an anterior hip replacement is to get up and move as fast as possible. We want you walking in the recovery room. I want you walking once you get home. Now, of course, you're not going to be doing any extreme or aggressive activities. You're going to take a break from things like golf or exercise for approximately 3 months. But moving around is definitely recommended, range of motion's recommended, early physical therapy can be beneficial, so early activity is definitely promoted. So if you find yourself having a hip issue, you should definitely come in and see us and get an evaluation. If it turns out that you have arthritis and you need a hip replacement, we're happy to talk you through that process. In general, it's a very good, very successful surgery. It's come a long way. Like I discussed earlier, patients are going home the same day. There's even a significant amount of patients that never require any pain medication. So come in and see us. We're happy to give you a consultation regarding your hip and let you know the best methods we can do to make sure that you're happy with your hip moving forward.